If you're over 70 and your doctor just celebrated getting your blood pressure down to 120/80, you need to hear this. A study published in a major medical journal followed more than 15,000 older adults for years, and what they found challenges everything we've been told about perfect blood pressure. The group with the lowest numbers, the ones hitting that textbook 120/80, did not live the longest. In fact, they experienced more falls, more complications, and in some cases, worse outcomes than those with slightly higher numbers. And in the next few minutes, you're going to understand why. Because this isn't just about numbers on a screen in a doctor's office. This is about what happens when you stand up in the middle of the night. This is about whether your brain gets enough blood when gravity suddenly shifts. This is about independence, or losing it in a single moment. Before we go any further, I want you to do something simple. Drop your age in the comments. Just your age. And if you've ever felt even a brief moment of dizziness when standing up, whether from a chair, your bed, or the bathroom, add the word dizzy. That detail matters more than you think. Here's what's happening quietly, every single day. A 76-year-old walks into a clinic. Blood pressure reads 146/84. The doctor frowns slightly. The guidelines say it should be lower. A prescription is written. A month later, another medication is added. Within a few months, the numbers look perfect. 122/78. Everyone feels reassured. The system worked. But something else is happening that no one is measuring. That same person stands up too quickly one evening. Within seconds, their blood pressure doesn't stay at 122/78. It drops, sometimes sharply, maybe to 95/60, maybe lower. The brain, which depends on steady blood flow, suddenly isn't getting what it needs. The room tilts, vision narrows, balance disappears. And in that split second, everything changes. Because for older adults, the danger isn't always high blood pressure. Sometimes, the real danger is blood pressure that's too low at the wrong moment. This is the part most people never hear. For decades, we've been told a simple message: the lower your blood pressure, the better. And for younger adults, that's largely true. Lowering high blood pressure reduces the risk of heart attacks, strokes, and long-term damage. But after a certain age, the body plays by different rules. What looks perfect on paper may not be perfect for your physiology anymore. In fact, emerging research shows something surprising. Older adults, especially those over 75, often do better with slightly higher blood pressure. Not dangerously high, but not aggressively low either. There's a range where the body functions best, where the brain stays perfused, where balance is preserved, and where the risk of sudden drops is minimized. And that range is not 120/80. To understand why, you need to understand what aging actually does to your body, not in theory, but in reality. Because your cardiovascular system at 75 is not just an older version of your system at 45. It's fundamentally different. The first change is something you can't see, but it affects every heartbeat you have. Your arteries become stiffer. When you're young, your arteries are flexible. They expand easily with each pulse of blood, cushioning the pressure and helping maintain smooth flow. But over time, those arteries lose elasticity. They become more rigid, less forgiving. Imagine a brand new rubber hose compared to one that's been sitting in the sun for years. The old one doesn't flex the same way. It resists, it pushes back. Your arteries do the same. And this matters because when your heart pumps blood into stiff arteries, the pressure behaves differently. The body often needs a slightly higher baseline pressure just to push blood effectively to vital organs, especially the brain. Now add gravity to the equation. When you stand up, blood has to travel upward against gravity to reach your brain. In a younger body, this adjustment happens instantly, but in an older body, that process slows down. Which brings us to the second change: your internal pressure sensors, called baroreceptors, don't respond as quickly as they used to. These sensors are designed to detect sudden changes in blood pressure. When you stand, they send rapid signals to your brain to tighten blood vessels and slightly increase your heart rate, stabilizing pressure. But with age, these signals become delayed. So if your resting blood pressure is already low, and your body is slow to compensate, the drop becomes more pronounced. That's when you feel it. That brief wave of dizziness, that moment where the world feels like it's shifting, that subtle loss of balance that most people brush off as just getting older. But it's not just aging. It's physiology. And then there's the third change, one that often goes unnoticed: your body processes medications differently. As you age, your kidneys and liver don't clear drugs as efficiently. Medications stay in your system longer, their effects become stronger, sometimes unpredictable. A dose that works perfectly for someone in their 50s may be too much for someone in their late 70s or 80s. So when multiple blood pressure medications are layered together to reach a target like 120/80, the combined effect can push the body beyond its safe range, especially during everyday movements like standing up. This is where the hidden risk begins. Because in a quiet doctor's office, sitting still, your blood pressure might look ideal. But your life doesn't happen sitting still. It happens when you move, when you stand, when you react, when your body needs to adapt quickly. And that's exactly where overly aggressive blood pressure control can become dangerous. Now here's where the data becomes impossible to ignore. In a large observational study of older adults, researchers grouped participants based on their average systolic blood pressure. Some were below 120, others fell between 120 and 130, then 130 to 140, 140 to 150, and above. They followed these individuals over several years, tracking not just heart attacks or strokes, but real-world outcomes, falls, hospitalizations, cognitive decline, and mortality. What they found surprised even the researchers. The group with the lowest risk of death was not the group with the lowest blood pressure. It was the group in the middle. Those with systolic blood pressure roughly between 130 and 140 consistently showed better survival rates, fewer serious falls, and fewer complications. Meanwhile, those with blood pressure below 120 experienced higher rates of dizziness, fainting episodes, kidney issues, and a significantly increased risk of falls. Think about that for a moment. The very number many people are striving for may actually increase risk in older age. Not because lowering blood pressure is inherently bad, but because lowering it too much, in the wrong body, at the wrong time, can disrupt the delicate balance your system now depends on. And the consequences of that imbalance are not small. A fall in your 30s is an inconvenience. A fall in your 70s or 80s can be life-altering. Hip fractures, hospital stays, loss of independence, complications that cascade into something much more serious. And often, it starts with something as simple as standing up. That's why this next part is so important. Because there is a simple way to detect whether your blood pressure is dropping too much when you change position, and almost no one is doing it regularly. It's called an orthostatic blood pressure test. And it takes less than 3 minutes. Tonight, you can do this at home. Lie down on your bed or couch and rest for 5 full minutes. Let your body settle completely. Then measure your blood pressure while still lying down. Write those numbers down. Next, stand up. Not slowly over several minutes, stand up the way you normally would. And immediately check your blood pressure again. Now compare the two readings. If your top number, the systolic, drops by more than 20 points, or your bottom number drops by more than 10, that's a significant change. It means your body is not maintaining stable pressure when you stand. And that puts you at higher risk. Even if your sitting blood pressure looks perfect. This is the hidden piece most people miss. Because standard measurements only capture one moment, usually when you're seated, calm, and still. But real life doesn't happen in that position. Your safety depends on how your body responds to movement. And if your pressure drops too much during those transitions, your brain simply isn't getting enough blood, even for a few seconds. That's all it takes. And here's the part that often goes unrecognized: many people adapt to this without realizing it. They stand more slowly, they pause before walking, they hold on to furniture, they assume it's normal. But it's not something to ignore. It's a signal. A signal that your current blood pressure target or the medications used to reach it might not be right for your body anymore. So what should your blood pressure actually be? This is where nuance matters. Because there is no single number that fits everyone. But research does point to ranges that tend to offer the best balance between protection and safety for older adults. For individuals between 65 and 74 who are generally healthy, a systolic range around 130 to 140 is often appropriate. For those between 75 and 84, that range may shift slightly higher, closer to 135 to 145. And for those over 85, or individuals who are more medically complex or frail, maintaining a systolic pressure between 140 and 150 may actually reduce risk rather than increase it. Notice the pattern. The target moves upward with age. Not because higher blood pressure becomes harmless, but because the risks of going too low begin to outweigh the benefits. And the bottom number, diastolic, matters too. When it drops too low, especially below 60 or 65. It can reduce blood flow to critical organs, including the heart itself. So even if the top number looks good, a very low bottom number can still signal a problem. This is why blood pressure management in older adults isn't about chasing perfection. It's about finding balance, protecting the heart while preserving stability, reducing long-term risks without increasing immediate ones, and most importantly, maintaining quality of life. Because numbers don't matter if they come at the cost of independence. Here's what this means for you, starting now. If you're over 70 and currently taking medication for blood pressure, begin tracking your readings at home, morning and evening, same time each day. Write them down. Look for patterns, not isolated numbers. Then perform the standing test you just learned. Pay attention to how you feel, not just what the numbers say. Do you feel steady when you stand, clear-headed, or do you notice even subtle changes? Bring that information to your doctor. Not as a challenge, but as a conversation. Ask what target is right for your age, your health, your lifestyle. Because the goal isn't to hit a universal number. The goal is to keep you safe, functional, and independent. And sometimes, that means accepting a slightly higher number in exchange for a much lower risk. What you now understand is something many people never hear. That blood pressure is not just about preventing events years from now. It's about protecting you in the moments that matter most. The moment you stand. The moment you walk. The moment your body